Hello everyone, and welcome. Today, we are talking about a common and uncomfortable problem for our furry friends, urinary tract infections, or UTIs. If you have ever wondered how a UTI is actually diagnosed in a dog, you are in the right place. We are going to walk through the signs you can spot at home and then dive into the specific tests your veterinarian will perform to get a proper diagnosis. First, let's cover the signs that your dog might have a UTI. It is important to be observant. You might notice your dog needing to go outside much more frequently than usual. They might strain to urinate, but only a small amount of urine comes out. Accidents in the house are another big red flag, especially if your dog has been perfectly house-trained for years. A very clear sign is blood in the urine, which can make it look pink or reddish. You may also see your dog licking their genital area excessively, which is a sign of irritation. Sometimes, they might even cry or whimper while urinating, showing they are in pain. The urine itself might also look cloudy or have a very strong, foul odor. If you see any of these signs, the most important step is to call your veterinarian. A proper diagnosis can only be made by a professional. At the vet's office, they will start by asking you about all the symptoms you have observed. Then, they will need a urine sample for testing. There are a couple of ways to get this. One method is a free catch sample, where you would use a clean container to catch urine while your dog is peeing. However, the best method, which your vet will likely perform, is called a cystocentesis. This involves using a small, sterile needle to take urine directly from the bladder. This ensures the sample is pure and not contaminated by bacteria from the skin or environment. Once they have the sample, the primary test is a urinalysis. This involves examining the urine on a chemical strip and under a microscope. The vet looks for key indicators like the presence of bacteria, white blood cells that fight infection, red blood cells, and tiny crystals that could lead to stones. If the urinalysis points to an infection, the gold standard follow-up test is a urine culture and sensitivity. For a culture, the lab will try to grow the specific bacteria from the urine sample. If bacteria grow, the sensitivity part of the test involves exposing those bacteria to different antibiotics to see which one is most effective at killing them. This is crucial because it ensures your dog gets the right medicine to clear the infection completely. For dogs who get frequent UTIs, your vet might also recommend further imaging, like an X-ray or an ultrasound, to check for underlying issues like bladder stones or other abnormalities. Thank you so much for watching today. We hope this information was helpful for you and your beloved pet. If you found this video valuable, please consider giving it a thumbs up and subscribing to our channel to support us. Hitting that notification bell will make sure you do not miss our future videos on keeping your pets happy and healthy. Your support allows us to continue creating content for pet parents just like you.